Hey, Joe Zarzer here. We're going to do another quick Meerkat legal discussion, mainly focusing on Florida personal injury cases, specifically car wrecks. And I think the one topic I'd like to talk about today is the fact that 95 to 98% of car wrecks in Florida result in folks going to the emergency room and being released with what I'll call innocuous release papers. General diagnoses of neck strain, back strain, whiplash is a common phrase used. The misleading nature of that is important because of the 95% or so that leave the hospital with those records, those kinds of diagnoses, about 50% of those people end up with surgical recommendations. And you might ask yourself, how in the world can somebody leave an emergency room with what looks like a clean bill of health and then end up having a serious surgery on their back or neck? And the answer is pretty simple, but unless you are around this enough, you don't really realize it. Emergency rooms are not in the business of diagnosing injuries. They are in the business of making sure they diagnose those things that can kill a person, acute injuries, that could kill a person in 48 hours. If you, though, have an injury, a serious injury that's even surgical in nature, but it's not something that's going to kill you, and many of the disc injuries to your back and neck are not going to kill you, those are not diagnosed. The only way those are really diagnosed is if the emergency room does an MRI, which they rarely do. So what you get in the MRI 9 times out of 10 is going to be an X-ray and a CT scan. They are looking for bleeds and fractures that could potentially kill you in 48 hours. Disc herniations that are surgical don't show up on either one of those tests generally. And they're not ordered even by a private physician for months, usually, unless there are significant symptoms. So those surgical issues don't go diagnosed even by your primary doctor for several months after an event and after the ER visit is over. So this is a long way of saying that just because you leave the ER with a clean bill of health, so to speak, cervical strain, there are no fractures, that doesn't mean you don't have a life-altering, serious permanent injury that I would suggest needs to be looked at. And to give you an idea of what these surgeries end up costing people, the typical disc fusion surgery will cost somewhere between $85,000 and $130,000. And unless you have serious insurance, those bills are obviously life-shattering. The other thing you need to pay attention to is once you have these kinds of surgeries, back and neck fusion surgeries or discectomies, you're dealing with a part of the body that's extremely sensitive and will potentially cause you major issues going forward. So those are also issues that can be compensated in a case like this. I urge everybody to make sure they pay attention to their bodies after a wreck. Pay little attention, if you will, to the insurance companies trying to get you to resolve the case. It's always smart to look into the situation yourself, and it's always smart to have a lawyer who's experienced, board certified, to look at the case before you pronounce it dead, and certainly before you take a couple $1,000s from an insurance company. If you have any questions about this or any other kind of personal injury case in Florida, you can find me on the web at zarzerlaw.com, of course on Twitter at zarzerlaw, and you can call us, of course, 855-HIRE-JOE. Thanks for paying attention.